Peace, peace. I'm Jasiri X. I am the co-founder and CEO of One Hood Media, and we'll welcome you again to Ask a Black Doctor. Ask a Black Doctor is a collaboration with One Hood Media and the Gateway Medical Society. We've been at it now over a year. It really came out of, wanting to inform specifically our community around the dangers of COVID-19, how to protect ourselves from COVID. Of course, we, morphed into, letting folks know about the vaccine and, answering folks' questions around the vaccine. But really, if you have just some general health questions, if you have, COVID related questions, vaccine related questions, feel free to hit the chat and drop some questions below. But, we're really excited to have on 3 more doctors to really talk about, where we are right now as we are kind of getting back out into society as some of these restrictions have came off, but also, want to make sure that as we're re-entering into society, some folks are, being required to go back to work, that we're doing it in a safe way, that we're doing it in a way that doesn't endanger ourselves, doesn't endanger our loved one, and doesn't endanger our children. And so I want to bring on our doctors and I want to ask them to introduce themselves. Starting with Dr. Salahuddin, say a little bit about their background and their, specific fields of medicine, and then we can kind of get into the conversation. So welcome to our doctors, and if you could start, Dr. Salahuddin, and we could get it cracking.
Absolutely, happy to be here again. Always have a good time on this show. So before I introduce myself, just want to give a shout out to my sister Nuri. Today's her birthday. Want to say we love you. Happy birthday. All right, so my name is Daniel Salahuddin. I am in my 5th and final year of training in both family medicine and psychiatry. So like I said, I've been here on the show before, looking forward to some good discussion about any COVID updates, Delta variant, vaccinations, what it means for you, what it means for us as a community, and what it means for our people. So as always, looking forward to a great conversation.
Thank you very much. Dr. Sims, this is your first time,
Yes.
You're being inducted into the Black Doctor media space. So welcome. If you could tell us a little bit about yourself.
Good evening. I'm Dr. Robin Sims, and I am a pediatrician by trade. I'm also the medical director of Primary Care Health Services. We're the largest federally qualified health center in Allegheny County, having 9 centers all over the county. Alma Illory Medical Center in Homewood is our main center and where our administrative offices are located. I've been practicing pediatrics for over 40 years, and half of this time I've spent at primary care. So I've been here practicing medicine in our community for many, many, many years, but I'm happy to be here. And I also have a son who's a 2nd-year medical student at The Ohio State University. So get ready for the next generation to pick up.
Come on now. No, that's wonderful. Thank you so much for your service. And thank you for, I know you all are super busy, but taking some time just to spend with us today in our community and, kind of answer our questions. And, a lot of folks might not know that Kyanna is very instrumental to the Ask a Black Doctor show and helps do a lot of stuff behind the scenes, including getting doctors, making sure that, we're on point for the show. But, you're also, just say a little bit about yourself, Kyanna, as well.
Definitely. Thank you. My name is Keanna Williamspate. I'm a public health professional, currently the project coordinator for Gateway Medical Society. I've been working with them for a year now. I'm also pre-med and applying to medical school right now. My healthcare interests are maternal child health and bridging the gaps with health disparities. So most of my work has been with Gateway Medical Society this year. And to give a little background on Gateway Medical Society, they have a mission to eradicate disparities in healthcare, and they were established in Pittsburgh in 1963 as a component of the National Medical Association. They're a volunteer organization of healthcare professionals that work toward promoting public health and general welfare of the community. The emphasis has been on minority and disadvantaged populations, and the goal is to enhance quality of health services to encourage and promote effective health education. And we're very grateful to our support from the Hines Endowment, the Allegheny County Health Department, Highmark, Allegheny Health Network, and UPMC, who've been supporting our efforts toward trying to bridge the gaps with educating the community on COVID-19 and influenza. So that's just a little background on myself and Gateway Medical Society.
Thank you so much for that, and thank you for all your. It's interesting. I'm used to you being in the chat, and so but you're with us today, so we're gonna miss you in the chat. So I did want to start with you, Dr. Salahuddin, because you had mentioned, right now it seems like it's a lot of conversation around like the Delta variant. Is it? I think Dr. Fauci said it was like the biggest threat right now. From what we're hearing, it's like spreads 60% faster. Is this something that we should be like super worried about? Is this kind of just like, the media scaring us? Can you tell us a little bit about it?
Yeah, absolutely. So just to give a little bit of background, the Delta variant is a variant that's become more widespread over the last several months from COVID. So viruses will typically mutate. That's what they do. They're always replicating. They replicate quickly. And so when you have that kind of replication, you're going to have alterations in DNA. And so because of some selective pressure being applied to those viruses, then they're going to become more prominent, especially if it's getting shown that this particular mutation helps them replicate faster. So that's what's going on with this Delta strand right now. So question number one, should we be concerned about it? Yes, we should be concerned about it. So we should be concerned, but we don't necessarily, there's no need to necessarily just panic about it. We have a strategy that we know works, and that strategy is going to be centering around vaccination. Our vaccines so far have been showing that they are effective, and they're effective against the Delta variant. There's data showing that the Delta variant does spread faster. It is more contagious. Whether or not it's deadlier, that's to be determined. We don't want to find that out, because if we're starting to find that out, that means that we've taken a turn for the worse. So in terms of conversations around the Delta variant, and what we're seeing around the country is that areas with low vaccination rates are experiencing the highest rates of Delta variant increase. As a result, in the United States, in some places such as Los Angeles County, they recently reinstituted their mask mandate for indoors. We're seeing around the world, in Tokyo for the Olympics, they're declaring a COVID state of emergency during that because of rising cases. So this Delta variant is definitely making its presence felt. And so it's at a point now where we need to continue being very vigilant and taking this seriously, because we don't want to be in a position where we were last year, where, things are going well in the summer, and then when we get into the fall and the winter, that's when things start not looking so good for us. So we definitely need to be doing the best that we can to making sure that we're all getting vaccinated and keeping this at bay.
Right. We had found out, I think it was yesterday, our brother Wiz Khalifa, our Pittsburgh representative, came down with COVID. So we definitely want to, keep him in our prayers and wish him a speedy recovery. It's interesting because we are kind of, coming back to going to events. I was at a celebration, for the life of Antoine Rose II earlier, and a lot of times when you go to events, it's not a lot of masks. I mean, so is this a simple, Dr. Sims? Is this a simple of us just remaining vigilant? Stay wearing masks, stay practicing social distance, because it seems like now, I just, I'm not going to say the person's name, but I just saw a friend in Whole Foods, and he just, stuck to like, shook, put his hand out to shake hands. And it's kind of like, I remember when like before it was like, I was giving you the elbow. It was like, we wasn't doing that. So are we maybe too eager to kind of get back to how things were?
I think we're becoming more comfortable. The weather is nice. We want to enjoy graduations and outside events. But yes, we've been vaccinated, those who have been vaccinated, and it does provide protection. And it's providing protection against the Delta variant. But it doesn't mean, even if you're vaccinated, that you won't get COVID. You still can get COVID even if you're vaccinated. What the vaccine does, it prevents the complications, hospitalization, serious disease, death. So I may put on a mask, even if I'm vaccinated, and I am vaccinated. If I'm going to go to an event where there's a lot of people and I don't know their vaccination status, it may be best to put on a mask, especially if you're indoors. So I would use common sense. If you feel comfortable putting on a mask, put on your mask, vaccinated or not.
I mean, at this point, we should have enough. I know I got just a drawer full of multicolored masks. But I think you're right. I mean, we had heard, I think it was today, a baseball game. I think it was a Yankees game was canceled. 3 of the people tested positive for COVID, but like you said, they were vaccinated. So I think sometimes, like being vaccinated doesn't mean you can't get COVID. But like you said, it means that hopefully if you get it, you won't suffer, those same symptoms as everybody else. I want to come to you, Kyanna. There's been this conversation about and particularly, I mean, a lot of it is, political, and it is super weird that, a health a crisis has become political. But there was this kind of narrative that if you're young and you're healthy, like you're good, if you're young and you're healthy, there's no need for you to worry about getting vaccinated. Just keep working out. I guess just eating right. That's good enough. What are you saying to some of your peers who might be hearing that information and might be saying I'm young, I'm feeling good. I work out every day. I quote unquote, I got a juicer. Therefore I don't need to get vaccinated.
Right. Well, I mean, that's a very important question. And honestly, I have people around me that ask me that all the time. But the truth of the matter is people who are young, whether they're teenagers or young adults, they're getting COVID. And at one point, they were the top percentage of individuals who were testing positive for COVID. So it's not that we're invincible because we're young. So young people can get COVID. They can get sick from COVID. They can get hospitalized from COVID. And because of that, it's very important to get vaccinated because that's the best way to protect yourself from getting sick, but also young people who may come across the virus and get infected with it, they can also pass that on to people with a more immunosuppressed immune system. So older adults who may not be as healthy, if you have COVID and you're young and healthy and you want to visit someone who's older, like your grandmother or something, you can pass that on to them. And also anyone who is on immunosuppressants in general, who may have other underlying health conditions, if you're not vaccinated and you get COVID and you're not very sick from it, you can pass that on to them and they can get very sick from it. So getting vaccinated is the best way to protect yourself and your loved ones as well. So just because you're young, a teenager, young adult, and you're healthy, you're living your best life, getting vaccinated is the best way to still protect yourself. And maybe you want to get out a little bit more, get vaccinated. That's the best way to offer yourself protection and to offer protection for those that you're around also.
Are you hearing that, Dr. Salahuddin, and some of the folks that you're around as well? Why should I get vaccinated? I'm younger, I'm healthy. And what are some of the things that you say to those folks?
Absolutely. So a lot of the messaging early on with COVID was it's affecting older adults, it's affecting folks who are immunocompromised. It's not, and so as a result, I mean, whether this was intentional or not intentional, what that does in the mind of younger folks is it makes you feel like you're invincible. Because I mean, while young folks do get sick, the fact of the matter is they don't get as sick. They can get very sick, but when you take a look at the distribution, I mean, it's very likely that if you're young and if you happen to have get COVID, then I'm sure that there are the situations where people who were just saying, "Oh, I had no symptoms, I had a runny nose, it's nothing more than the common cold," or whatever the case may be. But kind of like what Kyanna was mentioning, the effects of that are so much more far-reaching, because you may be getting other people around you sick. You yourself, you don't. That's one of the scariest things about COVID that scared me from day one. We don't know. We have no way of predicting how COVID is going to affect you. We have had people who have been the picture of health have COVID completely like kill them, basically. And so that's a really scary thing. And I think that there's a lot of a misconception that a lot of these young folks, particularly, this 18 to 26-year-old group, that they're invincible. I mean, because take a look at the vaccination data within that population, and it's really low, just over a third within that. Actually, no, 18 to 39 was just over a third. But if you take a look at Joe Biden's 4th of July, President Biden, I'm sorry, his 4th of July goals, that was wanting 70% of all adults to be vaccinated. If you take away the 18 to 26-year-olds, then we have reached that goal for so basically 27 up and plus. So all that to say is we really need to be doing a better job at targeting vaccine campaigns and efforts towards young folks. So, I mean, what I tell people who come to me with those concerns, who come to me being like, I'm good, I don't need this vaccine, I tell them exactly what I just said. Like, you don't know how it's going to affect you. And so far, like, this vaccine has shown to be safe. And so you're better off getting this vaccine than taking your chances getting COVID.
It's interesting. And then also, I think one of the things you all, I've learned just as a moderator on Ask a Black Doctor is we still don't know, like, what long-term effects, like, because it's only been around for a short period of time. And so you might have not had a lot of effects now, but we don't know what that means down the line, because we haven't been able to really study that. Speaking of outreach efforts to younger people, a video dropped. I think it was maybe like a couple weeks ago, and I was like, man, I get to play some hip hop or Ask a Black Doctor. I can't wait to play this. So we want to play a little bit of a video. Now this was also to promote like a Black dating site, but it was a famous song, Back That Thing Up, by Juvenile. And they flipped it to vax that thing up. We're going to just play we're not going to play the whole thing. Y'all can go find it yourself, but we'll just want to play a little bit of this video.
You're finna online date chat, find a mate chat, open up the okay profile picture looking tight chat, nice chat, got your bio reading right chat, precise chat, but before you find a date chat, you gotta wait chat, gotta go vaccinate chat, get it straight chat, girl you look good, want you vax that thing up, you's a handsome young brother, want you vax that thing up, dating real life, you need to vax.
So do you all think that, like, is this kind of messages that we need more of? Vax this thing up, particularly maybe for that 18 to 26 audience?
I mean, I think it's a good way to reach people. They know the tune, it can get stuck in their head. It's a way that can be effective for some people, make it fun. Instead of hearing someone sit there, talking monotonously, it's more relatable. So can work.
There were also, and I want to come to you, Dr. Sims. There were also, I read an article about some of the relatives of the victims of the Tuskegee experiment also were, kind of lending their voices to, encouraging folks to get vaccinated. Do you see some of those efforts like working in our community, or do you see like more work that we need to do to kind of encourage our folks to be vaccinated?
My message is whatever it takes. And I have to admit, when I looked at that video, I said, why do I have to sexualize everything? And my 2 adult children told me, Mom, look at the original video first. So I did. And I said, wow. And actually, they put some new words out there. Herd immunity. Herd immunity. We have to get 70% of our people vaccinated in order to get that herd immunity. And herd immunity is important remember, I'm a pediatrician. There are babies and children that can't get vaccinated. The Pfizer's only recommended from the 12-year-olds and up. So how about the little ones that aren't? as Keanna mentioned, how about the people who are immunocompromised that can't get vaccinated? So we have to take responsibility. If we can't get vaccinated, so we can protect the others. And as you mentioned about the Tuskegee people who are promoting the COVID vaccination, it is great because there are so many vaccine preventable diseases that even the new generation, Daniel and Kyanna, when I did my residency, we saw meningitis from Haemophilus influenza B. I mean, we saw measles epidemic come at least twice. We've eradicated polio almost. We don't see those horrible diseases. We don't even see chickenpox. HPV, the new vaccine that is actually a cancer preventing vaccine. Vaccine preventable diseases, it's important to get vaccines, not only the COVID vaccines, all those others. So yes, parents come in and say, no, I don't want to get COVID. And we do have parents that don't want any vaccines, but we've been doing such a good job with our vaccines that we don't see these diseases anymore. But it's so important that we have to put the word out. Vaccines are important because they prevent diseases that not only cause tremendous complications, but these diseases can take lives.
Right. It's interesting that you said that because we kind of had a conversation in pre-production about how a lot of the rhetoric around the COVID vaccine now have folks not wanting to take any vaccines. But you had talked about, these various the diseases that were eradicated. I'm wondering, like you said now, you have Pfizer open from ages 12 to 15. People that are 16 and up can get it. Just as a pediatrician, are folks coming in and kind of asking you about their children being vaccinated, and what are some of the conversations that you're having with parents, or what are some of the things that you're saying to families about why you believe it's important for their children to be vaccinated? Summertime now, but coming back to school is really like a month and a few weeks away.
Yes, definitely. I promote not only the COVID vaccine but the other vaccines to prevent the diseases that are that cause death and complications. But when a parent comes in, and thank goodness I'm a trusted messenger, I thank God for that, because there are patients. I'm in the second generation. I've been in my practice now for 21 years, and so I've seen now my patients now are having children. So they trust me, and they'll ask me, Dr. Sims, did you get the vaccine? Do you give your children the vaccine? And when I say yes, they trust me, and so I can convince some people. And we've actually started doing a tremendous job in the Pittsburgh area. The Pittsburgh School District is offering vaccine clinics. We're having a vaccine clinic in Homewood on July 31st, Operation A Better Block, and we're going to concentrate on vaccinating the 12-year-olds and older with the Pfizer vaccine. Keanna mentioned that there's another community event. So yes, it's important to get your children vaccinated if they're 12 years old and older. And I think by the end of this summer, possibly we'll be vaccinating younger children, maybe down to age 6 months. We'll wait and see.
Keanna, you had mentioned, I think it was Mount Airy is doing.
Mount Airy on 24th has a vaccine clinic for individuals 12 and up. They can register online for that.
Absolutely. So you're, and you had mentioned, when you kind of go amongst your family, people are asking you, so what are you saying to people about the benefits of like a child, somebody between 12 to 18? What are you saying that these are the benefits? This is why you believe like even somebody that young should be vaccinated. What are some of the things you're telling folks?
Right. Kids are around a lot of people all the time when they're in school. They have sports activities, other extracurricular activities, a lot of high contact, areas that they're touching, especially being in the schools, which puts you at a higher risk of getting a virus. Kids are always sick anyways. Even at 12 and up, you still get sick from just being in school sometimes because there's a lot going around. And so getting that vaccine can help protect your child from getting sick. While we see that children oftentimes are able to recover from COVID, there are some times where there's complications and you want to try your best to avoid that. But again, it's the same conversation. Kids may not have as severe symptoms, but they can pass that virus on to someone who is more inept to be sick from getting exposed to the virus. So it's not just about the kid, but about everyone else around them, but also providing as much protection as you can for your child can be the best gift that you can give them as they're going into these spaces, being around crowded environments, high touch areas, and so that you can have a little bit more comfortability while your child goes out to play basketball after school or whatever, you know, their activities are. So that's what I try to tell people. And then also to make it easier, especially in the fall, you can get the COVID vaccine with the flu shot at the same time. So you can do a 2-for-1, get them both whenever you're in the doctor's office. You know, a lot more doctor's offices are offering the Pfizer vaccine, which is great because it makes it more accessible. So, you know, you can get everything done at once. You don't have to have several appointments. You don't have to wait to get another vaccine if your child is due for their other vaccines as well. You can get them all in one appointment. So.
No, that definitely makes sense in terms of that activity. I'd be interested to find out, like, and I guess we'll find out soon, kind of like what these percentage of. I want to come back to you, Dr. Sims, because you know one of the things that I do is kind of like during this month of where we're like in between shows, I'll highlight some of the medical articles that kind of come across. And one of them was specifically around Black and Latino youth and COVID-19. It talked about what they call MultiSystem inflammatory syndrome, and that this was, it says, children exposed to COVID are at risk of developing multi-system inflammatory syndrome, and how this specifically is disproportionately affecting Black and Latino children. Can you talk a little bit about this and kind of, I guess, maybe how maybe as parents we could kind of identify this and some of the things that we can do to combat it?
Mm-hmm. Multi-system inflammatory disease. Multi-system, which means it attacks more than one system. Your kidneys, your lungs, your heart, your skin, and it's an inflammatory disease. They don't really know the cause, but definitely they know that the children who get it had COVID or either were exposed to someone who had COVID. And the symptoms, how it presents, usually your child can have GI symptoms, diarrhea, vomiting, bloodshot eyes, a fever, respiratory problems, and so stiff neck, rash on the skin. So if you suspect that your child may have this or even any kind of serious disease, you don't know what's happening, contact your primary care doctor, because this is a serious disease. Children need hospitalization, they need supportive care. Some die, but most recover, which is the good news. So there's no specific treatment, just supportive care, but it does. And why it affects our population, people of color more, we don't really know the answers, but we need to get vaccinated to prevent even serious diseases like this.
Right. And I didn't know this. Dr. Johnson just put in the chat that over 400 children have died in the U.S. from COVID. Majority have been Black and brown. That's information I didn't know. Kind of like, you said, Dr. Salahuddin, a lot of the times when we think about COVID and people dying, we're thinking about older people, people that have, maybe had previous diseases. A lot of times when I'm thinking about a child, dying of COVID-19. I know like last month we kind of talked about health disparities like in race, but I did want you to just touch on Dr. Salahuddin, because we're at a point where like not only did COVID, getting COVID-19 disproportionately affect our communities and brown communities, indigenous communities, but also it seems like actually getting the vaccine is also like our communities are like lower. So it's like we got more COVID and then we're less vaccinated. And, people are now looking and wondering like this could have a long-term effect, on the future of our communities. What are some things that we can do to really, I guess, protect ourselves and really protect our communities going forward if this, if something else comes down the line?
Yeah, it's a great question. All great questions. So the number one thing we need to do is name it. If there's something going on that we're seeing that we are suffering disproportionately from COVID. Back when we were trying to get testing to find out who was suffering from COVID, we weren't getting adequate testing in our communities. Now that the vaccine is being rolled out, we're seeing disproportionate effects in terms of who's getting the vaccine versus who's not getting the vaccine. And so we really need to, when we're looking at the data of who is actually dying from COVID, Black and brown communities are definitely suffering a greater proportion of COVID deaths. And so The reasons for that, I mean, we can literally, like you were mentioning, we had an episode on that, on social determinants of health. We talk about racism in this country, talk about the upstream determinants of health. So talking about housing insecurity, food insecurity, education opportunities, employment opportunities, over policing. These are all related. These systems don't exist in a vacuum. They're all related, and they all have an effect on ultimate health outcome. They talk about intergenerational trauma. That in and of itself can weaken the immune system. And so there are a lot of aspects that are constantly moving that you can't necessarily point to one specific reason. What we can do, aside from fixing all of the other things that I just mentioned, just all of society's problems, is right. What we can do is be more deliberate in our efforts. So, for example, in terms of vaccination sites, so when the vaccine rollouts were initially happening, what was being found is there was a really the digital divide was starting to come out. So what was happening is a lot of vaccination sites and vaccination clinics were opening up their portals, and you were able to sign up for them electronically. Well, they were and a lot of them, and they were being targeted towards more underserved, marginalized communities. What was actually happening is because the folks living in those communities were not able to access, like maybe the online portals or the system to access those vaccines, we had folks coming from surrounding areas, typically more suburban areas, predominantly white areas, and taking all the vaccines. And so that was a huge issue that was going on, because we were saying, okay, we're having the vaccine clinics in the communities that need them most, but we're not seeing that proportional increase in vaccine equity in terms of who the distribution and who's getting the vaccine versus who's not getting the vaccine. So as we have gotten to a point now where vaccines aren't as much demand as they were several months ago, we need to be more creative in terms of our vaccine strategies, because we have vaccines to go around now, but so now we really need to be doing that targeted education, that targeted effort. We need to have other health professionals who look like the communities that we're in, that we're coming from, to really share that message about the importance of getting vaccinated. Because if it's not coming from us, then again, the healthcare system has done no service to our communities whatsoever. As a system overall, like, we've done a lot of things to lose the trust of our community, Black and brown communities, and so I think that having those messages coming from people who look like you is really meaningful. And so we need to continue propelling that message forward, emphasizing the importance of vaccination, and honestly showing the hope associated with vaccination, because I think we can all agree that our lives have gotten substantially better since we've been vaccinated. Like, we've been able to see other folks who are vaccinated. We've been able to do things that a year ago or so we weren't able to do. And so it really has provided a sense of normalcy, but we just need to emphasize that the way to get back to that, vaccination is the first step.
Yeah, no, I think you make a great point about kind of those community informational sessions, because like you said, I mean, I know it seems like it's been around for a while, but it's still relatively new. And to kind of go into the communities and have those conversations are super important. I think one of the things, Dr. Sims, that has come up is around like how long is the vaccine last? Like, am I, because I know there's been, some of these variants came out. People were saying, like, you're going to have to get another shot. Does this last for a year? Is this going to be kind of like the flu vaccine, where like every year we get a flu shot? Is it going to be like every year a COVID-19 vaccine shot? Have we got information to that effect as of yet?
Right. The simple answer is no. We don't know yet. But to be clear, fully vaccinated means that you've received two shots. 2 of the Pfizer, 2 of the Moderna, 1 of the Johnson & Johnson. 2 weeks after your second shot of the Moderna and Pfizer, you're considered fully vaccinated. And after 2 weeks after the 1 shot J&J Johnson, you're fully vaccinated. Those vaccines right now are protective. Remember, it decreases severity, hospitalizations, death. It even protects you against the complications of the new variants, the Delta variant, the Lambda variant. They are continuing doing studies right now, and so far They're not saying that we need boosters. We don't know. A new virus. We can't predict the future. We'll continue to follow these and we'll know whether or not, and if we need another booster, we get the flu vaccine every year. And just to make a point, we're encouraging flu vaccines in the fall, even for children as young as 6 months of age. But right now, we're not requiring a booster. We don't know. The clinical trials are ongoing.
No, thank you for that. I mean, I think that's, I didn't know like you had to wait 2 weeks. I'm thinking like you got your second shot. You ready to call Juvenile and Manny Fresh and go and get your party on. No, you got to wait 2 weeks, No, man, I just think that's important. That's important information, like so we can be as safe as possible. And like you said, it's hard because we're trying to do this thing on the move, and I think that's what makes sometimes people a little bit apprehensive. I want to come to you, Kyanna, because you had talked about maternal medicine being one of the things that you're most interested in. What are you, is there a conversation, or what is the conversation around if a woman is pregnant, or if a mother is breastfeeding, is it safe for them in that state to get vaccinated?
Right. So right now the data is showing that for individuals who are pregnant or maybe breastfeeding, that there's no high risk associated with getting the vaccine, and also that the vaccine can offer protection for pregnant women and women who are breastfeeding. Additionally, individuals who are breastfeeding, some of that immunity from the vaccine can get passed on to the child. So you can also provide some protection to your infant if you get vaccinated while breastfeeding. There's been no data right now that has shown that there's been negative side effects from individuals who were pregnant or breastfeeding who got the vaccine. They're still doing research on that. However, currently, gynecologists, OB-GYNs, they're currently recommending their patients to get vaccinated if they're pregnant or breastfeeding because of the protection that it can offer.
No, that's important. I know that there was a conversation, I'll come to you, Dr. Salahuddin, around, the FDA, I guess, certifying the vaccine, that hasn't happened yet. And that folks were feeling like maybe if that happens, that would encourage more folks to get it. What is the, I guess the action plan? Because I mean, there's still a lot of folks that are, outright like, anti-vaccine. They're kind of, tying it to the government or whatever, and you talked a little bit about, kind of like healthcare as a whole failing, something that Dr. Bay, who's one of the hosts of our show, What Black Pittsburgh Needs to Know, says all the time, that, we trust the science, we don't trust the scientists. So has there been a, like a concerted effort to say, these are some things we need to do to kind of push back on some of these, kind of myths that are still out there and fear that folks have in our community around it?
Yeah, so today, the Surgeon General, Dr. Vivek Murthy, said that COVID misinformation is the greatest threat to our, as a significant public health threat, because that's exactly what it is. Because we are having a lot of misinformation about this vaccine, about COVID in general, influencing and impacting and honestly killing the lives of so many people. And so it's important for us to be really precise, direct and authentic with our messaging behind everything. So in terms of the vaccine, I know we hear a lot of skepticism about, how fast this happened and this FDA designation of emergency use authorization, and all this, basically the whole process. So it just goes to show what amazing things we're capable of doing if we pool resources towards one particular area. Because vaccines, let's be real, vaccines don't usually take as fast as it took to create these COVID vaccines. However, in what other situations have we had so many different resources being directed for this very specific cause? So that goes to show you what amazing things can happen when we all have a common goal towards doing something. So in this situation, we had a goal, We did it, and it was not, in all the trials that were done for the vaccines were as rigorous as otherwise as it would have been if this vaccine had been in the pipeline in the works for years, you know? So I think it's because there is that variation in terms of the timeline that we're having so much skepticism about how fast the vaccine came. What's reassuring is that the people who were originally part of the trials, I mean, as far as we know, including ourselves who have been vaccinated, are not having any ill effects from the vaccine. We know all the vaccine ingredients, you know, that is readily available information. So we know exactly what you are putting into your body. We know what it does. We have seen hospitalizations and deaths, mortality overall decrease significantly. You know, we're seeing that reflected in the fact that we're going back to our regular lives. You know, we've been able to have indoor gatherings with other people who are also vaccinated, unmasked, which is something that we wouldn't have been able to even think about a year and a half ago. So I think that, again, when it comes to talking about promoting this vaccine, I think one of the things that really resonates with people in general is this whole idea of getting back to normalcy, this idea of hope, this idea of this is what it's going to take to get us to where we want to be. Because I think we can all agree that we are tired of COVID. Let's be real. We're all tired of COVID. We want things to be back to normal. And this is unprecedented, something that we haven't faced since in our lifetimes. And so we just need to be mindful of that. And I think emphasizing the fact that this is the key to getting us where we need to be.
Yeah, no, you make a great point. Dr. Sims, you know, a lot of times, and you know, I know like when I was in school, I know a lot of schools, it was like certain vaccines were required, you know, to go to school. Do you see like a time coming where like children will be required? I know it's not now required, and I know that, like you said, is a lot of folks. Well, I did see some universities. Mm-hmm. I haven't seen, of course, you know, in elementary school. I did see some universities saying that they were going to require, you know, students before they came on campus to be vaccinated. Would you recommend us kind of like going to there? Like, is that where we should be going to ultimately, you know, make sure that we're safe?
As I mentioned before, I mean, I'm a vaccine champion. I'm an immunization champion. I recommend vaccination. As far as mandating, I think that's kind of too political. Whether or not
right. You're just a doctor.
Yes, I wish we could, but you know, people have freedom of choice. But we have to be 100%. Mindful. We have to protect others too. But I did want to mention too, as far as just being comfortable, I want to do a shout out to Dr. Kesmekia Corbett. There was a Black female scientist that was instrumental in the development of the Moderna vaccine. People of color were included in the clinical trials. So yes, we should follow the science, and we should follow the scientists. 350 million people have been vaccinated with this COVID vaccine. This vaccine saved lives. My message is, what are you waiting for?
No, that's a great point. And I think like a lot of times I don't like almost, you know, when you talk about like a campaign, because the information that you're saying is not information that I readily hear. You know, it's not like, you know, you readily hear that information, you hear the other side, but then also it's like, well, what's the alternative? Is the alternative that we just like, you know, do we just die without a vaccine? I mean, like, what's the alternative? So I do think, you know, like every time I hear you all talk, I'm like, man, I wish this could be broadcast, you know, to many more people, because I don't, you know, like when I kind of go on my social media or see my things, I don't necessarily see that level of information kind of getting out to our community. Are you seeing the same things, Kyanna?
Yeah, so actually I just finished up a program at Chatham, and they have been sending out emails saying that they're requiring students, faculty, and staff to be vaccinated before coming back in the fall. They've offered vaccine clinics on campus for people affiliated with Chatham and their families and friends to be able to get vaccinated as well. And you can't mandate anyone to get vaccinated. So they're requiring, if you're choosing not to get vaccinated, to submit your your official reason for why, and then you can be admitted onto campus. But because they are encouraging everyone to become vaccinated, whether they're a student, faculty, or staff, they're moving away from having certain restrictions on campus where you can study, where you can work, and more of the professors can come back to campus instead of having online classrooms. So there's a lot of benefits to being able to be vaccinated within these public spaces, within the school settings, because there was definitely a barrier to trying to learn while online when your teacher is just behind a computer screen and they can't give you all of the resources that you typically would have had access to whenever they're in person. So there's a lot of benefits to being able to encourage the organization that you're working with to be vaccinated so that there can be more freedom and you can have more relief knowing that there's protection around you and that you don't have as much of a risk of getting sick from COVID if you do get exposed from it.
Right. So are you saying that Chatham is saying that are they not letting you on campus, or
you have to submit your official documentation from the doctor saying that you met the requirements to not get vaccinated, but students, faculty, and staff are required to get vaccinated before coming back in the fall.
Yeah, I'm Dr. Salahuddin. I did want to, and we had talked about it. It's summertime, folks are out. It's I don't know if y'all have been watching the NBA finals, but they have like an area outside of the building that is just like filled with people to the max, and it's like I don't know if I'm ready for that level of of closeness with a wide range of people, but like I know that like. When it was COVID and we did have a vaccination, it was like we can go on walks, we can do certain things. Like are there certain things that we should like that's okay to do? Are there certain things that you would say like even though you're vaccinated, I wouldn't recommend you doing this or that?
Right. So as Dr. Sims mentioned, just because you're vaccinated doesn't mean that you cannot get COVID. And so I think it's important to be mindful of that whenever you decide to do any particular thing. So for example, we have very clear guidelines from the CDC and evidence showing that you can safely be in a room unmasked indoors with other people who are also vaccinated. So if you're in that situation, then you should go for it. The situations where it gets a little bit dicey are situations that are more public, so as opposed to being with your family or friends or whatever, where that everyone's vaccinated. When you get into situations where you're going out, maybe you're out at the club or what have you, at a bar or a restaurant or whatever the case may be, where they're not verifying what people's vaccination status, and because mask mandates have been lifted, you're having people who have been who are potentially not vaccinated, who you're interacting with that may be carrying COVID, and that's a risk. Let's be real. And so having the vaccine definitely protects you in that situation. If you do get COVID, then you're probably not going to get very sick from it, but you would still have it, and you may give it to you may still shed some virus, although those studies are ongoing to say to what degree that's happening, but it's still a risk. And so situations kind of what you're talking about in the NBA finals where you have packed stadiums, I was seeing similar things during the Copa America, and same thing for the Euros for soccer there. We're packing stadiums now. So people's vaccine statuses, I don't think they're verifying those. And so I think that I would think twice about doing that in this particular situation. But honestly, I think that if you're able, we're at a point now where nothing is black and white. We're kind of operating in the gray, and you have to be okay with the level of risk that you're assuming based off of what you decide to make and the choice you make for yourself. And so, but I think as a general rule of thumb, just being mindful, especially as the Delta variant is circulating. Fortunately, like I was mentioning before, we're seeing the Delta variant less so in areas that have high vaccination rates. So if you're traveling, just check out the vaccination rates, see what you're dealing with, and then you can make your decisions according to that.
No, that's a great point. Dr. Sims, it is like summertime, like Kennywood's open, a lot of other theme parks and amusement parks. What are you like? What would you recommend? And I'm sure parents ask you, hey, Is it, is it safe to go on this vacation here? Is it okay to go to Kennywood? Because I know last year we was kind of like, nah, like stay away, from anywhere. What should folks be doing now?
So if you're walking at Kennywood out in the open air with your vaccinated family members, you don't have to be masked. But if I'm standing in line waiting for that, I don't know, that new Steelers roller coaster, when you're lined up with people, pull up your mask, vaccinated or not. You don't know the status of the neighbor who's standing by you. And even if you're in closed spaces like where you're singing, vaccinated or not, you should be wearing a mask. They even mention if you're in sports activities where, you're putting out, COVID is spread by respiratory droplets. Anything close up, vaccinated or not, wear your mask. I mean, we're used to wearing masks. Like you said, we have a mask in every color to match every outfit. We're used to that. Protect yourself, protect others around you. So I would recommend, if you're in a situation, especially indoors and you're close to people, vaccinated or not, wear a mask.
Mm-hmm.
Absolutely. And I'm sure, and I want to come to Kyanna. I'm assuming it's the same. It's a lot of, this is vacation times. You look on IG, people are all over the world, on beaches and different places. Are you kind of giving advice to some of your friends as well?
Yeah, I mean, I definitely recommend if you're going to be indoors with a group of people who are not vaccinated, especially large populations, like being in a club or a bar, wear your mask, wear it properly to do the best that you can to protect yourself, whether you're vaccinated or not. I don't strongly encourage people to go to the club or to the bars, but I understand if that's the choice that you're choosing to make, there's nothing anyone can do. So what can you do to reduce your risk? Wear a mask, get vaccinated. Those are the vaccine is the number one way that you can protect yourself. Wearing the mask is secondary. So making sure you're bringing in all of your gear that you can to armor yourself against getting sick while still having fun, do that. Do the best that you can. But if you're outdoors and you're around people who are vaccinated, you're around a small group of people being vaccinated, you may be able to be a little bit more lax. But when in doubt, wear your mask. Have your mask on hand at all times, just in case,
Yeah, and I think like sanitizer, and I almost feel like we're back now to like where we were as we first got the information, because it seemed like once the mandates went, even a lot of businesses were like, like I said, I was just at Whole Foods. They used to like wipe down. They used to have the person wiping down the carts. Now they like, yo, handle your own thing right now. So I do, just want to encourage people, like, it's still like you still can catch stuff, what I'm saying? Particularly, if folks have decided like not to be vaccinated, make sure you got your hand sanitizer, make sure you got your, your wipes on you, and all of that stuff, because all that stuff becomes, to me, I think, even more important now, as we get like a little bit more lax, in the way things are going. So we're close to that time, the hour always kind of goes pretty quickly. Any final words, Dr. Salahuddin, for the folks that you just want to share before we close out?
Yeah, I mean, I think that the big theme of today has been, please get vaccinated. If you've already gotten vaccinated, please encourage others who who have not been vaccinated to get vaccinated. This is truly the pathway out of this pandemic. And as we're starting to think of the emerging threats of the Delta variant, I feel like the United States there's been a little bit of a lag for the rest of the world. The rest of the world is kind of giving us a warning signal right now of things to come. And there have been some restrictions that have been kind of doubled down on recently around the world. So I think that we can maybe anticipate that in the United States. Who knows? Again, this has all become very political, unfortunately. But just continue to stay vigilant. Please, please, please get vaccinated and make sure that you're staying safe when being mindful when indoors, wearing masks as appropriate.
Yeah, it is kind of weird to me that we would send people to Tokyo in a state of emergency. I mean, it's kind of like, I mean, it'd be dollars over. I mean, don't let anybody put dollars over your health. You know what I'm saying? That's what I would recommend to folks. And I think, Naomi Osaka kind of, showing us that, when it comes to like mental health, some other things. So shout out to her. Dr. Sims, any last comments for our community?
I just wanted to mention that in the news, they've shown that there's been an increase in the number of URIs, upper respiratory tract infections. Colds now are coming back because we're getting more comfortable. We're pulling down the mask. We're not remembering to sanitize or practice that physical distancing. And two, to make a point that even our flu vaccines that we get on a yearly basis, they're under the emergency use authorization every year because the flu vaccine has to change every year because the virus changes, it mutates. So it's not new, it's not uncommon. So right now, encourage everyone to get their COVID vaccine. What are you waiting for? And if we require a booster, so what? So be it, if that's what it takes to get back to normalcy. But we want our community to be well. We want that herd immunity to get out there so we can make the people who can't get vaccinated safe also.
No, you make a good point. I forgot about that. Like, we weren't really getting colds. The flu was, I guess, at its all-time low, and it was because we were doing all of these things that we probably maybe should have been doing in the first place, in terms of making sure like germs wasn't around us. And so yeah, just to stay vigilant with that. Even now, because like you said, like now we're going back, we shaking hands, we hugging, you know what I'm saying? And it's like, hey, let's wait until we're all the way out of this. Any last words, Kyanna, that you have?
Yeah, so I really just want to push the message that if you're not vaccinated and you're wearing a mask, it does not offer you as much protection as getting the vaccine can offer you. And if you have underlying health conditions, and your doctor, is encouraging you to get the vaccine, please get vaccinated. It's the best thing that you can do for yourself to protect yourself from severe illness or death or hospitalization from COVID. And also, if you're pregnant or breastfeeding, it's safe to get the vaccine. You can offer immunity to your infant if you get vaccinated while you're breastfeeding. And I just want to encourage people to make the best decisions that they can for their health. Whenever they go out into this world, continue to wash your hands, wear your mask. And just a little plug from the Gateway Medical Society, on July 24th, we have our community symposium. We're collaborating with Pittsburgh Black Nurses in Action, and the topic will be around maternal child health. So if you go on our Facebook page, you'll be able to see that flyer, but it's next Saturday at 11 a.m. for an hour online. So just wanted to plug that in, and just thankful to be able to talk to everybody on here.
Absolutely. Gotta get the plug in. And that's important. I think like, to me, what's powerful about this is like, for folks that, and I just would encourage folks to talk to experts. I know we love our YouTube videos, but, talk to experts. And I think the powerful thing about Gateway Medical Society is these is, somebody, you have Dr. Sims, who's been doing this for 40 years, a member of our community. Like, let's talk to folks, you know what I'm saying? Like, talk to medical professional folks that you can trust, and ask questions. Like, don't be afraid to ask questions, meaningful questions as well. That's one of the reasons that we have this show. I also want to encourage people, right, like, if you're watching this, I want you to, when this goes off, there's an online fundraiser happening right now called Hotline Ring. It's benefiting arts organizations that are majority Black and queer led in the city. We kind of all came together to do a collective fundraiser that was led by the Kelly Strayhorn. And so you can go to Kelly Strayhorn's website information and log into Hotline Ring. There's still a lot happening, a lot of organizers, performances. And then you can support, arts organizations that are, using our talents and gifts to speak directly for our community. So we thank you again. We will see y'all next month. This has been Ask a Black Doctor. Thank you, Dr. Johnson, and thank you to the Gateway Medical Society. We'll see y'all next month. Peace.